Today, I am going to talk about one of the most common reason why people get vertigo, and that condition is called as benign paroxysmal positional vertigo. Friends, benign paroxysmal positional vertigo is a sensation where you feel that you are spinning or is the world around you is spinning. In both the situation, the condition is vertigo. Now, as you have seen my previous videos, I have been explaining a lot about vertigo and different types of vestibular disorder, but BPPV is one which is the commonest of all. Now, why does it happen? What to be done for it? Let's discuss about that. Now, BPPV majorly happens due to a problem inside your internal ear organ, which is called as vestibular system or else vestibular organ. Now, I will not go into the details of the anatomy of this because it's really complex and very boring. But what I'll try to do is I'll try to explain it in a very simple way. Now, inside your ear, in this organ which is called as vestibular organ, there are something called as calcium crystals. These calcium crystals move inside the ear in a tube-like structure which is called as semicircular canal. This tube-like structure also have fluid in which these crystals are floating. Now, for example, whenever I turn or tilt my neck towards one side, these crystals will slightly move and will give me the awareness and the sense that I have turned my neck to the left hand side in association with something called as hair cells, which are the nerve receptors which gives a sensation of movement or which sends the signal from the organ to the brain. Many times this calcium crystals gets dislodged. These dislodged crystals when go to the lowest part of the canal due to extreme movement like turning, like bending down or looking up, at that time it will overstimulate the hair cells or nerve endings that are present in the deepest layer or in the lower layer of the semicircular canals. Now, in this deepest and the lowest layer of semicircular canal is your balance nerve. The nerve that sends signal from your ear to the brain and give the approximation or information to the brain about your balance. Now, when this nerve gets overstimulated, your brain gets false sensation or false message of lack of balance, and that's where you feel vertigo. So, what's the solution? It's simple. We need to make sure that those dislodged crystals that are now in the lower part of the canal moves back again to its original position, and that will get relief from you. It can come whenever this dislodgement of this crystal will happen. The number one symptom will be spinning sensation. Yes, you might feel that the world around you is spinning or else you are spinning around the world. It's very similar to the sensation that we feel when we play on a merry-go-round or else when we are playing or when we are sitting in a giant wheel or any of the ride that we sit on an amusement park, which involves a lot of rotatory movement. We feel some time to settle down, right? Now, same thing happens with an individual suffering from vertigo. Whenever he is moving around and all of a sudden he turns and there is a dislodgement of this crystal, they go down at the lower part of your ear canal and stimulates your balance nerve and gives the false sensation, and that's how he starts feeling the spinning sensation. This vertigo will last for around 1 minute to 5 minutes, and this vertigo symptoms can be mild to severe also depending on how much stimulation is happening and how long these crystals takes time to dislodge or go back to its original place. Now, the second problem that comes along with it is fear of fall. There is a constant fear of falling that is due to lack of balance, due to which there is a lot of postural adjustment that your body try to do to protect yourself, and that's where your body starts training neck muscle, start holding yourself tight, and this start giving symptoms of headache, neck pain, body ache, etc. So all of a sudden, an individual who is healthy, doing fine, starts feeling sick, weak, and feels pain in his musculoskeletal system. That's not all. Nausea is also one of the common symptoms that is very common associated with vertigo, especially benign paroxysmal positional vertigo. And in severe condition, this individual with nausea can also end up vomiting. Now let's understand what we can do to solve this problem. Now,
in order to reduce your vertigo, we are going to do an Epley's maneuver. In order to do this maneuver, sit first over a long surface. Now lie down on your back, keeping a pillow or else a slanted wedge pillow. Go slightly up in a way that your neck is hanging downwards. Now you need to rotate your neck by 45 degrees on the affected side. Spend some time over there till you feel symptoms coming under control. Afterwards, turn your neck to the opposite direction. Again, spend some seconds in that same position. Once that position is done, now you need to roll over on that side, keeping your chin tucked. Be there for some time, then come to sitting position. Once you sit back, stay in the same position of chin tuck and come back. And you are good to go. So friends, this is how you can get relief from your vertigo with this simple maneuver. But again, a disclaimer for you. Every patient is different and every outcome is also different. So make sure to see your physiotherapist before starting any of the measure. Thank you.